Thank you very much. So our session is specifically dedicated on the identification and traceability of biological medicinal products. And before we start and go into the details, and I think we have 3 excellent presentations to explain to you the challenges and the importance of this quite important topic. So before we enter into the specific sessions, I wanted to give you a very brief overview. First of all, what we define as a biological medicinal product. So our definition, which is also published in guidance document published by the EMA, is a medicine that contains one or more active substances which are made by or which are derived from a living organism to treat a disease or genetic disorders. So this is a very important class of medicinal products which deserve certainly specific attention. You will hear also in subsequent sessions and presentations the reference to a biosimilar medicinal product. So we define a biosimilar medicine as a medicine which is similar to a biological medicine that has been already authorized. So a biosimilar contains a known biological active substance, but differs perhaps in the way on how it has been manufactured. And also this has a big input on the way on how we monitor the safety. If you look at why the identification and the traceability for biological medicinal products is needed, there are a few points that we also need to consider. Biological medicinal products are based on active substances which are larger, which are more complex in their structure, so they are mainly referring to proteins. So they, again, are quite different from the classical molecules that we have been dealt with in the past. They are complex, not only from the structural presentation, but also by the way they are produced and manufactured. And as a result of that, there may be small differences which may have a big impact on the safety profile of a medicinal product. And again, therefore, it's quite important that we devote specific dedication to the monitoring of the safety profile of these medicines. And as a third point, it's also worthwhile to mention that the biological medicines are also more likely to be recognized by the body's immune system as foreign, and therefore we are more likely to expect immune reactions against these types of medicinal products. Again, an area which deserves specific attention from a safety monitoring perspective. So you have heard through the new legislation that we have new requirements, and one of the new requirements that also affect biological medicinal products are the requirements for additional monitoring. And we will have a specific session later on by Dr. Mick Foy, who will explain you really what the requirements are on additional monitoring and what the benefits are with these requirements. But this is just here to highlight the fact that as part of the new legislation, the agency, in collaboration with the member states, has to set up and also maintain and make publicly available a list of medicinal products which are subject to additional monitoring. And this list of products which will be subject to additional monitoring will, of course, also include biological medicinal products, and this will refer to any biological medicinal product which has been authorized as of the 1st of January 2011. Now, from the adverse reaction reporting requirements, Dr. Rain has already mentioned previously the Article 102 provisions, where you will see that we have now put a lot of requirements, but also tools at the hand of the member states in order to facilitate adverse reaction reporting. And in order to do that, here we have provisions in the Article 102, which will allow the member states really to take appropriate measures to encourage patients, doctors, pharmacists, and other healthcare professionals to report suspected adverse reactions. And even the legislation allows for the active involvement of organizations which are representing consumers, patients, and healthcare professionals in these activities. The facilitation of patient reporting is very often referred to in the new legislation. With that, of course, there are also other obligations, because we don't only want to collect data, but we want to make also sure that we receive accurate and verifiable data, which will allow us to conduct the scientific evaluation of the suspected adverse reactions. And also here, specific measures have been put in place. And last not but least, and I think this is the key to all these activities, is the importance that there will be measures in place that will allow to ensure that the public is given important information on pharmacovigilance concerns relating to the use of medicinal products in a timely manner. So in this context, with all these new tools that allow for the empowerment of reporting of adverse reactions, we have, of course, also a challenge, and that goes back to the identification and traceability of medicinal products, and as we have said for our session topic, specifically also biological medicinal products. So you will therefore see that in the new legislation there have been put specific provisions which puts obligations on the member states to ensure that all appropriate measures are taken to clearly identify any biological medicinal product which has been prescribed, dispensed, or sold in their territory. And from an identification perspective, the legislation makes clear reference that this refers to the name of the medicinal product, but also, quite importantly, to the batch number of the medicinal product. And when we think again about the characteristics of a biological medicinal product and the importance also of the manufacturing process of these products, the batch number is really key to the monitoring of the safety. So for the mechanisms to obtain the identification, it links back to the adverse reaction reporting requirements, as we have just stated. So here the reference is made through the methods for collecting of information or through the follow-up of suspected adverse reaction reports. And my colleagues who will present now in detail the different requirements will elaborate further on this specific topic. And last not but least, I would also like to make a reference to the link with the international standards. So there has been a lot of work going on in the context of international standardization. This goes back specifically to a request that we have received from the European Commission a few years ago to focus specifically on how biologic medicinal products can be identified for the purpose of pharmacovigilance. And in addition, where the European Commission has also empowered the European Medicines Agency to engage actively with standards development organizations to produce a standard which should support our pharmacovigilance activities in the future. And just very briefly to highlight the two standards that we have been working on over the last years and where we have, I think, dedicated a lot of efforts. So the first standard is referring to identification of medicinal products. And as the name refers to, it is referring to the unique identification of a medicinal product at different levels. So when you look at the standards, you will see that the unique identification will be based on a characterization and a unique identifier of the substances which are contained in a medicinal product. And you will see in the subsequent presentations that, for instance, the way how we identified substances on the basis of the name is not really the state of the art, and specifically in the area of biological medicinal products, this is quite challenging. The standard also allowed the identification of the level of the pharmaceutical product. So you are familiar with the concept of the API, the active pharmaceutical ingredient. So this links to this concept as well. Then we have identification at the level of the medicinal product, where we are focusing specific on the characteristics of the product in relation to the name, but also to the marketing authorization holder, and linked to that then that the presentation or the medicinal product may be presented in different pack sizes or different ways on the characteristics of the packaging. For biological medicinal products, again, quite important, identification can go down to the batch level. And all this is also linked to the data carrier that we have already in use. So the barcodes, which are linked again to the level of the medicinal products, that can be for the barcode on the outer packaging or for some complex medicinal products on the immediate packaging as well. From this identification perspective, there is also another important provision in the legislation, which was also mentioned already in several presentations today, and that is the link to the provisions of the Article 57, paragraph 2 of the new legislation, where again, the legislation has empowered the agency to establish and maintain a list of all medicinal products authorized in the Union, which includes, of course, also biological medicinal products. And again, this is really key from the data collection perspective in order to identify products correctly and then to support subsequently safety monitoring, signal detection, and risk management in an efficient way. And as a last bullet point to mention before I hand over to my colleagues is the second standard that has been developed, that is the new standard on individual case safety reports, which will bring major improvements to the way on how we perform adverse reaction reporting at the moment. And also to explain to you that this standard is fully integrating the identification of medicinal product concepts as well. So hopefully, with all the work that has been going on at international level, this will be the future in order to drive data collection and the quality of the data with which we will be working.